Okay, good morning, everyone. Uh, Very nice turnout in this very cold morning. Thank you very much for attending. Today I chose to talk about brain anatomy, MRI based. Okay, so I will not make like slides and PowerPoint and some boring stuff that will make you all asleep by the end. We'll do something interactive, like we'll have a brain MRI and we'll just talk. What's this? What's that? And I'll try to incorporate some of the MRI into the anatomy, some of the MRI physics, let's say, into the anatomy that we see, trying to make sense of all of it. If you have any questions, we can answer, and I hope you'll have fun. Okay? So, first of all, this is a brain MRI of a young patient that we have recently, I think. Yeah, it's been a few days for the imaging. Anyway, first, before we start, the whole lectures will be on the YouTube channel. You can just go there, see whatever you like, review it as you like. Anyway, so first of all, very good, thank you. You start the MRI by taking a quick look at the brain. First, I will try to make this as basic as possible. Let's starting from scratch, from zero, and working our way up. First, you need to know that we have coronal, axial, and sagittal imaging levels or planes in MRI or CT or whatever. The coronal is this one, coronal imaging, that is cuts parallel to the front of the body. Okay, this we call coronal. Okay, while axial is transverse to the plane of the body, like this one. This is what we call transverse images. Okay, and we have the third one is what? Sagittal. That is perpendicular to the coronal, like this one here. Okay, these are sagittal images. This is the first thing. So we are agreeing that the planes are either axial, coronal, or sagittal. There are other planes like axial oblique, coronal oblique. We will not talk about them now. We'll satisfy with the basic ones. First, we'll start with the axial. The axial images are the most basic one. You need always to start with the axial and you work your way from that. Okay? This is what we call T2 weighted image in the MRI. It's what we called what? T2 weighted. Always don't forget the weighted. When you say this is a T2 image, that's scientifically wrong. You need to say T2 weighted. Why? It is something related to physics that will need some time to explain. I don't have the time to do it now, so maybe we'll do it later, but always you say T2 weighted, T1 weighted. You don't say T2 image or T1 image, okay? We'll explain it maybe later. How do we know this is a T2 weighted image? You look at the fluid. Where do we see fluid in the brain? In the CSF, in the orbits, in the eye globe, I mean, okay? You can see the eye globe is what? White or black? White. White means T2 weighted, okay? You can see the CSF and the lateral ventricle is what? White. White means T2 weighted. What about this one? The orbits or the eye globes are what? Black. So this means T1 weighted. Okay? The same thing, the CSF is T1 weighted. So we are agreeing to the basics. We have axial, coronal, sagittal levels of imaging. We have T1 and T2 weighted images. These are the most basic images. Every MRI exam of everything in the body must have at least T1 and T2. There are other things. We'll not talk about it now. We'll stick with the T1 and the T2. Okay? There. T1 weighted images like or love fat, while T2 weighted images love fluid. Okay? خلينا نحط هاي يعني this is a basic fact, just keep it in mind. T1 weighted images love fat. T1 يحب الفات. Okay? ال T2 يحب fluid. شلون يعني؟ Fat and the T1 will be hyper intense, يعني whiter, more bright, while fluid in the T2 will be hyper intense or whiter or more bright. Okay? يعني in the brain, which one has more fat, the white matter or the gray matter? The white matter, because it has myelin. Myelin is fat. Okay, the white matter are nerve fibers. Nerve fibers myelinated. Myelin contains fat. So the white matter will be brighter than the gray matter on the T1 weighted image. You can see here, right? This is the gray matter, the dark line here. It contains less fat, more cells, okay? More water. So it appears darker on T1 weighted image, while the white matter contains fat, myelin, which appears more bright on the what? T1 weighted image. لحد الآن okay? زين. Let's see on the T2. T2 loves what? Fluid. So the gray matter contains more cells. Cells contains water. So it appears what? Brighter on T2 weighted image, while the the white matter contains myelin اللي هو fat. T2 ما يحب الفات. شو يطلع؟ bright darker on the T2 weighted image. تمام؟ So now we agree that this is the gray matter and this is the white matter. How the gray matter appears on T1, how the white matter appears on T1, and how the gray matter appears on T2, and how the white matter on T2, and why. Okay? Now, the brain, the human brain, consists of three main parts. Okay? اللي هما cerebrum, cerebellum, and brainstem. Okay? The cerebrum is everything above the tentorium cerebelli and at the skull base. Okay? In the posterior fossa, you have the cerebellum posteriorly and the brainstem anteriorly. The brainstem consists of three parts اللي هما medulla oblongata, pons, and midbrain. Okay? يعني starting with the big going to the small. We have cerebrum, cerebellum, and brainstem. The brainstem contains the medulla, the pons, and the midbrain. Okay? زين. Human can live without cerebrum or cerebellum. If the brainstem is good, we are alive. Vegetable state, non-responsive, but alive. يعني البرينستم contains all the vital centers. You breathe, your heart beat, your GI system is working, your blood is circulating, everything is okay, but completely unconscious, خارج نطاق التغطية. Vegetable state, some vegetative state. Okay? So the cerebrum and the cerebellum are for movement and interaction and thinking and consciousness and everything. Brainstem is for vital functions. Okay? يعني stroke بالbrainstem can kill. Stroke بالcerebrum, the big one, this one, most likely will not kill you. The patient might have some sort of movement disorder or deficiency in the motor function or sensory function, but he will not be dead. Okay? So the most important part for life is the brainstem. Okay? Now, let's again go back to the axial images. What are these, T1 or T2? T2, because fluid is bright. Okay? We have gray matter and white matter. We have on the brain surface, the cerebrum surface, the cerebral aspect surface, you have these ridges, grooves, and in between them, heights, let's say, hills and valleys, okay? The grooves, we call them sulcus or sulci in plural, okay? While between the two grooves is the gyrus. So we have this sulcus, and between them is a gyrus. Again, sulcus, for example here, sulcus here, between them is a gyrus. Sulcus, between them is a gyrus. And every gyrus contains gray matter and white matter. Okay? Come on. We have deep gray matter and the cortical gray matter. The gray matter on the cortex, this is the cortical gray matter, the superficial one, the whatever, the peripheral one, as you liked. While here, you can see this, we agreed, gray matter on T2, it's hyper or whiter or brighter, okay? So you can see these bright things here. Let me make a little bit adjustment to the image. You can see these bright things here. These are also gray matter, but deep, more superficial. On the superficial, you see this. And on the deep, you see this. These, the deep ones, we call it the basal ganglia. شو نسمي الdeep ones? The basal ganglia. Okay? What are the basal ganglia that do we have? We have the following. First, anteriorly, this one, it's the head of the caudate nucleus. It's not the caudate, it's the head of the caudate. The caudate nucleus is a very big, very tall one. This is just the head of it, part of it, okay? Then you have this dark thing, we call it, this is a white matter. This is the internal capsule. It's a white matter. We'll talk about it later. And it looks like, I don't know, some two limbs, okay? Posterior to it, you have this gray matter, the white thing, it's the thalamus. So you have the head of the caudate nucleus, the thalamus, and in between the two limbs, we have the lentiform nucleus. Lentiform nucleus. It looks like a lens. That's why we call it lentiform. It's composed of two parts. This lentiform nucleus متكونة من قطعتين. Composed of two parts. The medial one, the small one here, it's called the globus pallidus. Okay? While the lateral one, the more outer one, called putamen. Together, they are the lentiform nucleus. Okay? So when I say lentiform nucleus, I'm talking about both of them. When I'm saying globus pallidus, I'm talking about the medial part of the lentiform nucleus. When I say the putamen, I'm talking about the lateral part of lentiform nucleus. Okay? Putamen usually larger. Okay. Now, if you look carefully, between the caudate, the head of the caudate nucleus, and the lentiform nucleus, you can see some white lines here. Do you see it? Some thin, very thin white lines, like striations. Okay? So, the caudate with the lentiform together, they are called the corpus striatum. Corpus means body, striatum means striated, the striated body. Okay? And when I say this corpus striatum, I mean what? Caudate and lentiform. They are linked together by fibers that makes together the corpus striatum. Okay? لحد الآن كل شيء okay؟ ما عندنا أي together، ما حد كذا. Good. So, the basal or the deep gray matter includes the caudate, the head of the caudate nucleus, the lentiform nucleus, and the thalamus. The lentiform nucleus is composed from globus pallidus and putamen. Globus pallidus, putamen plus caudate equals corpus striatum. Okay? Nice. So what's this dark thing here? We agreed that dark things on T2 are white matter. This is called the internal capsule. Internal capsule is composed of anterior limb, genu, and posterior limb. It's like that. Anterior limb, genu, posterior limb. Okay? Anterior, genu, and posterior limb. And between the two limbs is the what? The lentiform nucleus. The outer border of the lentiform nucleus is what? There's external capsule. We have internal and external. سهلة. Okay? Good. Now, the brain, the cerebrum part of the brain, composed of lobes. How many lobes we have? We have four. The frontal, the parietal, the temporal, and the occipital. Okay? They are not just anatomical lobes, not real lobes, not like the lung. You have the upper lobe, lower lobe. They are not separated from each other by strict septum or fissure. They're just anatomical lobes. Okay? So, first of all, you need to separate the frontal lobe from the parietal lobe. Okay? How do we know where is the frontal and where is the parietal? You need to look for a sulcus that's called the central sulcus. Central sulcus, we agree the sulcus is the groove. You look for the groove that separates the frontal from the parietal. How do you know where is the central sulcus? It's easy. The only one that reaches the midline. السلكس الوحيد اللي يوصل للميدلاين هو السنترال sulcus. Where you can see this one reaching the midline. The rest are not reaching. So the only one that reaches the midline is the central sulcus. Okay? So, and everything anterior to it is frontal. Posterior to it is parietal. Okay? Again, you can see this is the one that reaches the midline. Again, you have here the one that reaches the midline. Everything anterior to it is frontal. Okay? You can see that the frontal lobe is big one. It's like take a large portion of the brain. Why is that? Because our personality is there. Okay? We are humans because of the frontal. Our frontal lobe is evolved more than animals. That's why we think, we behave, we invent, we draw, we sing, we read, everything is the frontal. Our being a human being is the frontal lobe. That's why we have big frontals. Okay? While animals, they have small frontal. For example, dogs, they have big olfactory area. They smell well, but their frontal lobe is smaller. You know, it's like a function. So, again, when you have this central, everything anterior to it is the frontal lobe, posterior to it is the parietal lobe. Okay? Now, the gyrus anterior to the central sulcus, this is the central, okay? I think obvious here. واضح مو? So, the gyrus anterior to it is the pre-central gyrus, while posterior to it is the post-central gyrus. Pre-central gyrus contains what cortex? Motor cortex. Post-central contains sensory cortex. So, if someone have a stroke in the precentral gyrus, you expect to see motor deficit. His hand does not work, his leg does not work, I don't know, something does not work. Okay? While if it is in the post-central gyrus, you expect to see sensory loss. Like he doesn't feel his hand, doesn't feel his face, doesn't feel something like that. So we have precentral and post-central. These are very important parts. Okay? Then after the precentral, you have three gyri. I think we can see it better on the sagittal image maybe. Although I don't like to switch to other planes now. You have three gyri, the superior, middle, and inferior frontal gyrus, separated by two sulci, the superior frontal sulcus and the inferior frontal sulcus. Okay? It's not that easy to demonstrate on a single image. You need to see multiple images, but anyway. So, we have the superior and the inferior sulci separating the superior, middle, and inferior frontal gyrus. Okay? So, this is the frontal lobe. Now, how to separate frontal lobe from temporal lobe? You look for the Sylvian fissure, which is like a big fissure here on the lateral aspect of the brain, separating the frontal from the temporal. Again, we can go to the axial. Oh, sorry, not this one. This one. Okay. You look for this. This is the Sylvian. This big one here and big one here. The Sylvian fissure separating. Everything above it is frontal or frontoparietal. Everything below it is what? temporal. حلو. At the Sylvian fissure, you notice there is, if you look carefully, you can see there are like gray matter deep within the Sylvian fissure. This is the Sylvian fissure, and it's gray matter deep with it. يعني داخله covered by, you can see this one is gray matter, and you can see a cover from here and a cover from here. يعني gray matter comes and covers a deeper gray matter. Okay, this is called insula. This deep gray matter called what? Insula. The insula ما تحب تكون متكشفة. Does not like to be uncovered. It likes to be covered. So each cover we call it what? Opericulum. Okay, you have frontal opericulum, parietal opericulum, and temporal opericulum. You have three opericula covering the insula. Okay, you can see frontal lobe here gives like a cover to the insula. Parietal cover gives a cover to the insula, and if you go more inferiorly, you can see even the temporal part is sending an opericulum or a cover for the insula. So the insula will be covered inside overlying gray matter, opericula. That's the temporal, parietal, and frontal. Okay? لحد الآن تمام. لو بدينا نفلت الموضوع. Any questions? Good. So, we have here the temporal lobe, and we have the frontal lobe, and we have the parietal lobe. It's also a big part, but the frontal is bigger, okay? And you have the last thing here, this part, this tiny small one, is the occipital lobe. It's concerned with vision. And as far as the human concerned, the eyes and nose are not that much evolved like animals. Animals have much better sight or smelling. So you can see the occipital lobe is relatively small compared to the rest of the brain. Okay? We can't see like infrared or ultraviolet. We can't see in dark. We can't see. These are things that animals can do, we cannot do. But we can think. So we have bigger frontal. Okay? Now, this is the cerebrum. Okay? The supratentorial part. All of the, before I will not, before I move to the brain stem, which is the complex things, we'll stay simple as much as possible. Within the brain, there are cavities. These cavities are filled by fluid. This fluid is called the CSF, the cerebrospinal fluid. So, let's start by reviewing the ventricles or the cavities of the cerebrum. Okay? The ventricles of the cerebrum, we have the lateral ventricle, which is like the biggest one. Okay? What do we have in the lateral ventricle? We have three horns. The frontal horn of the lateral ventricle here. Okay? We have the occipital horn of the lateral ventricle. You can see it here going to the occipital lobe. Okay? And we have what? The temporal horns of the lateral ventricle. So the lateral ventricle composed of frontal and the occipital, and then if you continue with it, the temporal. All of them, they are connected at the atrium of the lateral ventricle. This is the body here of the lateral ventricle. So temporal, frontal, and parietal horn, and occipital horns connects at the atrium. They are all filled with the CSF. Okay, where does the CSF comes from? Comes from something called choroid plexus. If you look carefully here, you can, let me try. You can see something. You can see something in the ventricle here. This is a choroid plexus. This secretes or excretes CSF. Okay. The lateral ventricle, the fluid in it will go into this cavity, slit-like cavity between the two thalami. That's called what? Third ventricle. Via this tiny foramen here, you can see foramen here and foramen here, called what? Foramen of Monro. So the fluid from the lateral ventricle will go into the third ventricle by the way of the foramen of Monro. Okay? And then from the third ventricle, fluid will go into fourth ventricle. Where is the fourth ventricle? If we go down further at the posterior fossa, infratentorially, you can see this cavity here. So, how does the fluid gets from the third ventricle, this slit-like thing, into this cavity? By way of this tiny, this dot, the small dot, it's called the aqueduct, the cerebral aqueduct of Sylvius. It's here, okay? The cerebral aqueduct of Sylvius is very, very thin duct that transmits the CSF from the lateral ventricle to the, from the third ventricle to the fourth ventricle. This one, the fourth ventricle, okay? And from here, from the fourth ventricle, the fluid or the CSF will go by these foramina and another midline foramen somewhere here, what's called the foramen of Luschka and Magendie. And then it will go into the perispinal space, into the spinal canal, into the around the spinal cord, down. Okay? So that's the circulation of the CSF. How it's produced. Also, we have طبعا choroid plexus elsewhere, like we have in the temporal horn, small choroid plexus. We have in the fourth ventricle another choroid plexus. So it's not one; there are multiple. The biggest one is in the lateral ventricle. Okay. Now, moving to the sagittal images, I think we need to address them also. Okay. Before we move to the sagittal, it's a good question. The cisterns are just like lakes, collections of CSF. Okay? We see them mostly at the skull base, at the base of the brain, inferior to the brain, below the brain. Okay? These are sometimes when they occluded also might cause abnormalities if you have lesion there, if you have tumor or whatever. Okay? You have first this, you can see collection of CSF here. Below it is what we call this, what? The cella torsica. Above it, this is the supracellular cistern. Cella torsica, supracellular cistern. Okay? Above the cella, it's a I think we can see it better on the sagittal. Again, let's go. We have here, this is the sphenoid air sinus, contains above it is the cella torsica. Within the cella torsica we have this thing here, that is what? Pituitary gland. Okay? So above it is this CSF, which is called supracellular cistern. Okay? Again, we go back to the sagittal images. We have posterior to the supracellular, exactly. This is the supracellular, and exactly posterior to it is the these are the that's why I wanted to go for the brainstem first, then describe the cisterns. But anyway, these are the two cerebral pedicles, and between them is the interpedicular cistern. Okay? Now, this is the quadrigeminal plate here, and posterior to it is what we call quadrigeminal cistern. And laterally here and there, here and here, is the ambient cisterns. So these are all spaces filled with CSF. We have the ambient cistern, the quadrigeminal plate cistern, we have the supracellular cistern, the interpeduncular cisterns. There is something called cisternography that is used in specific indications to detect the CSF flow in these cisterns, and whether they are patent or inflamed or closed or infiltrated or whatever. We will not talk about it now. It's outside of the scope of this talk. Okay? So, if we take a quick look on the sagittal image of the...
This image, we have 4 cisterns in one image.
Exactly. It's the skull base. So it's this, that's why I call it the basal cisterns. They are all collected there. Okay?
Also on sagittal you can see suprapineal cistern.
Again, yes, you are right. Suprapineal. Just a second, let it load. It should be somewhere here. Okay? So, sagittal image, midline. Exactly at the midline. What do we see? First of all, you look and you see this big thing here. This is called the corpus callosum. Corpus callosum consists of, it's a white matter, of course. It's a big bundle of wires connecting right and left cerebral hemispheres, okay? Exactly. Commissures consisting of the rostrum, okay, then a genu, then a body, then splenium. 4 parts: rostrum, genu, body, and splenium, okay? Above it, immediately, you have a sulcus, immediately above it, called the pericallosal sulcus, okay? Immediately above the corpus callosum is the pericallosal sulcus. Then you have this big gyrus here called the cingulate gyrus. What do we call it? Cingulate gyrus. Good. And then another sulcus called the cingulate sulcus. So I have pericallosal sulcus, cingulate gyrus, cingulate sulcus. Tamam? This is exactly in the midline. Okay? Then you have this sulcus here, you can see it posteriorly, separating the parietal from the occipital, called the what? Calcarine sulcus. Exactly. This sulcus here, you can see this one? So this is the occipital, the small one, the occipital lobe, separated from the parietal. Sorry, sorry, yeah, you are right. Yeah, the occipital, the parieto-occipital sulcus separates the parietal lobe from the occipital lobe, and the calcarine sulcus separates the occipital lobe from the temporal lobe. Exactly. You are completely right. I'm sorry. Okay. Then we have this thing here and this thing here. This is the cerebellum and the brainstem. The brainstem is composed of medulla oblongata, pons, and midbrain. Okay? And you can very nicely see here this thin channel connecting this to this. What's this one? Fourth ventricle. And above is the third ventricle. And in between the channel is what? The aqueduct of Sylvius that we saw in the axial images, if you remember. Okay? So, if you have hydrocephalus or dilated ventricle that is limited to the third and lateral, third ventricle and lateral ventricle are dilated, but the fourth ventricle is normal, then it means the aqueduct of Sylvius is obstructed somewhere, somehow. Okay? Well, if you have all of them dilated, that means that it's not the aqueduct, it's something else, affecting all the ventricles. Tamam? So, the cerebellum consists of 2 cerebellar hemispheres, okay, right and left, and it's connected with the brainstem by 3 peduncles, the inferior, middle, and superior cerebellar peduncles, okay, and the biggest one is the middle cerebellar peduncle connecting the cerebellum to the pons, okay, so this is the pons. And this is the big one, is the middle cerebellar peduncle connecting the cerebellum to the pons, okay? And if you go little bit superiorly, you can see here, these are the superior cerebellar peduncles, this tiny thing here, okay? I think the cuts are a little bit thick, but I can show you the inferior are not very quite seen, but the superior cerebellar peduncle are seen obviously here. Okay?
Connecting to the midbrain or pons again?
Superior should be to the midbrain. The middle are the middle at the with the pons, and the inferior should be with the pontomedullary junction or medulla oblongata. Okay? So I think we don't have any more time. Maybe we should stop here, continue some other day. Okay? This is just a quick review. We will not finish the brain anatomy in 30 or 40 minutes. This will be very mission impossible. but I think we have a very rough idea about the brain anatomy, the general big ones. We're not going into the details. Anyway, we might continue some other day. If you have any questions, I'm more than happy to answer. Okay? Good. Thank you very much. I don't